So let's talk about morning sickness. How common is it? You've probably heard all about it from your friends and family because it's actually very common. It affects about 75% of women. So 3 in 4 women will experience it to some degree, and it doesn't only happen in the morning. It can actually occur at any time of the day. It usually peaks at around week 9 of pregnancy and typically improves by about week 20, so midway through the pregnancy, but not always. Some women will unfortunately experience it all throughout pregnancy, and some women may have very minor symptoms. About 1%, so just 1 in 100 pregnant women will experience the most severe version of morning sickness, and it's called Hyperemesis gravidarum. And this is really, really important to distinguish from just your average morning sickness because it can actually require hospital admission. So typically what happens is that you're unable to keep food and fluids down because of persistent vomiting and nausea. And that can lead to significant and severe dehydration and malnutrition, which is really dangerous not only for the baby, but for the mother as well. So often it requires hospital care to some degree so that you can receive medications for the nausea to kind of ease that and then ensure that you're getting enough hydration and electrolytes. So what causes nausea and vomiting in pregnancy? So it's not super clear in the literature, but it's likely related to hormones, including HCG, estrogen, and progesterone. But there are a lot of different hypotheses that exist at the moment. There are certain risk factors for morning sickness, so carrying multiple babies, like twins or triplets, for example, having a baby girl versus a baby boy will actually put you at higher risk based on the literature, and having a family history of morning sickness as well. And if you're generally prone to motion sickness or migraines, you are actually at a higher risk. So what can you do to help? Generally, you want to try dietary and lifestyle tips before going to medications. So number 1 is you want to get enough rest. I know that's not always easy, but as much as you can, and stay hydrated as much as possible, especially when you're pregnant. That's super, super important, not only for yourself, but also to support the baby's growth. You do want to drink at least 8 to 12 cups of water or fluids a day, and hopefully that can help a little bit. Number 2, you want to eat smaller, more frequent meals throughout the day. So instead of 3 big meals a day, you want to do 5 or 6 smaller meals. And the reason for that is typically when your stomach is empty for long periods of time, or sometimes even short periods of time, that can trigger some of the nausea and vomiting, and that's very common. So you do want to kind of have food in your stomach throughout the day as much as possible. The next tip is to try the BRAT diet, which is a very simple kind of bland diet that is unlikely to trigger nausea and vomiting. So BRAT stands for B for banana, R for rice, A for applesauce, T for toast, and for tea. And then finally, ginger may be helpful for some people. So maybe like sucking on a ginger candy or having some ginger tea. That can be helpful for some women, and some people swear by that. So what if you've tried all of these things consistently and you don't find any relief? That can be very discouraging because nausea and vomiting can be very debilitating and very serious sometimes. So what you can do is bring it up to your family doctor or your primary care provider, and they might be able to prescribe something for you that can help. Typically for nausea and vomiting, especially if it's less severe, you might be able to get away with just taking vitamin B6, which is also known as pyridoxine. And that's generally recommended first line because it's very safe and can be effective. If that doesn't work, your doctor may recommend a combination therapy of vitamin B6 plus a medication called doxylamine. And that's an antihistamine medication that has been proven to be helpful for nausea vomiting. And that's marketed as Diclectin in Canada and Diaclegus in the US. So these medications can be very effective, but not for everyone. So of course, after trying that, if you don't find much relief at all, your doctor may prescribe some different medications that work through different pathways. So when should you call your doctor or bring this up to them? Firstly, if it's significantly affecting your day-to-day activities and it's becoming quite debilitating, you do want to bring it up because they might have some great suggestions for you or be able to prescribe something for you. If you can't keep fluids down for 48 hours or more, that can be potentially very serious. So you do want to reach out to your doctor or seek medical care at that point because you may need some medications for the nausea or some hydration and electrolytes potentially. If you're noticing some signs of significant dehydration, so you're feeling very dizzy all the time, you're producing very little urine or very dark colored urine consistently because you're not taking in fluids, or you're noticing like a racing heartbeat or palpitations, those might be signs of significant dehydration, and you do want to seek medical attention for that. Follow your gut. If you are suffering, do reach out to your primary care provider, and hopefully they'll be able to help you. If you found this video helpful, let me know by giving me a thumbs up, and I'll make more content like this. And if you ever want to check out the references that I use, I'll list them down in the description box, and you can do some more reading of your own if you'd like. So thanks for watching.